Okay, so I'm presenting case study 5, biomedical engineer. These are the contents. The overview. So the biomedical engineer was working for the vice president of R&D, which is a startup company. They are producing a device that attaches to the wrist during operation in the hospital. So this mechanical engineer also joined the biomedical engineer in conducting these experiments on themselves with the producing wrist device. So the aches began to occur in the wrist, and this pressure sensor said that the pressure exceeded 200 mmHg. So the vice president said to ignore this pain and that he had an unusual wrist. So he researched in the biomedical library and found that over 9 mmHg can cause carpal tunnel syndrome. So he ended up telling the anesthesiologist who conducted a meeting with a vascular surgeon for answers about his wrist pain. So the hand surgeon was pulled in, and they found that after a long surgery, tissue necrosis could occur, which is death of tissue. During a quarterly meeting, the technical advisor had heard about the injuries and stated the company would pay for any treatment. So the technical advisor felt concerned due to these injuries and demanded a change in design for the wrist device. So the primary ethical issue is that the vice president of R&D told the biomedical engineer he had an unusual wrist and thought he was exaggerating the pain. Therefore, he wanted the biomedical engineer to stay quiet about the consistent pain. So as time went on with the consistent pain, the vice president had advised a discussion with the anesthesiologist for pain. And carpal tunnel syndrome was found on the wrist, and the wrist device was proven to cause tissue necrosis, which is again death of the tissue. So under deontological ethics, the ethical premise is the ethical theory that uses ethics to distinguish right from wrong. So the context is that the wrist device exceeded 9 mmHg, which can cause carpal tunnel syndrome. The vice president of R&D didn't think it was worth bringing up to the anesthesiologist because he said he was exaggerating his wrist. The vice president saw consistent pain and advised biomedical engineer to speak up, and the device was mandated to have a design change since it caused so many issues. So our intermediate conclusion is that the vice president at first wanted the biomedical engineer to keep quiet, but chose to have the engineer speak up since of the pain. And the device was mandated to be corrected so that no further injuries could occur. So the biomedical engineer's decision, as well as the VP, was ethical. Under ethics of care, the ethical premise is the ethical theory that focuses on moral action or emotion on interconnected relationships. The biomedical engineer cared about his wrist injuries and did speak up. Not only was the issue stated, he wanted to make sure that no other patients had felt this pain or had the risk of necrosis. The technical advisor stated he would pay for all the treatment for both engineers, and a mandated change for the device showed that care for the patients was present due to prevention of carpal tunnel and tissue necrosis. So the biomedical engineer, vice president, and technical advisor all showed ethics of care by correcting the tissues for prevention of injury. Therefore, the ethical decision by professionals in this case was ethical. So this here is the stated ethical code for biomedical engineers. So they have professional healthcare research and training obligations, and here are all of their stated rules. So the ethical code application to the case study. So recently stated it was the ethical code for biomedical engineers. In bold are the rules that apply to the case study regarding this wrist device. So here, bold are professional and healthcare research training obligations. So, number 1, under professional engineering duties state that the engineers should use their skills to enhance safety, health, and welfare. So the team of professionals under deontological ethics did abide by this. Number 2, under professional engineering duties state that the engineers should strive by action in order to keep the honor and reputation of biomedical profession. So the team of professionals followed these rules by using ethics of care and deontological ethics. Number 2, under the healthcare engineering duties, states that engineers should consider large consequences in their work, which would be done by changing the design of the wrist device. So potential objections. Objection to deontological ethics. Under deontological ethics, rules are said to distinguish right from wrong, so the biomedical engineer and mechanical engineer should not have practiced the wrist operations on themselves. Therefore, there could have been more precautionary steps taken in order to secure the safety of the engineers. So under deontological ethics, the decision to conduct this procedure on the engineers was unethical. Under objections to ethics of care, moral action and emotion is used on interconnection relationships. So the vice president at first did not show care when the biomedical engineer showed that he was having symptoms of carpal tunnel syndrome from their device. Therefore, under ethics of care, the vice president's actions were unethical. So, conclusion, the professionals in this case study made ethical decisions under deontological and ethics of care theory. The rules under the professional health and healthcare obligations of the Biomedical Engineering Society Code of Ethics were abided by. The device is mandated to have a design change which will help keep the professional reputation of a biomedical engineer, and the technical advisor made sure his employees were taken care of and properly treated. Overall, these decisions throughout the case were ethical under deontological and ethics of care theory, as well as followed the Biomedical Engineering Code of Ethics. References here, and